time for today's first keynote speaker, Dr. Zhang Wenhong. Dr. Zhang is professor and head of the Center for Infectious Disease at Huashan Hospital in Fudan University. Dubbed the gatekeeper of Shanghai, Dr. Zhang led a team of more than 60 medical experts in the fight against COVID-19. He shared information with the public in a no-nonsense, genuine, and sometimes humorous style, giving Chinese people desperately needed in comfort and levity, and turned millions of Chinese into his fans. Following Dr. Zhang's speech will be a Q&A. Feel free to type your questions in your Baidu or YouTube live stream chat box. Without further delay, please join us to welcome Dr. Zhang. Welcome, Dr. Zhang.
It's my great pleasure to attend the Berkeley China Summit today. And I'm very happy to share some experience in China. And I want that our experience can help to collaborate with my colleagues in the world to end the pandemic quickly. So today, my topic will be the how to fight the COVID-19, the challenges and the opportunity to end the epidemics. So firstly, I will share the current information about the epidemics of COVID-19 in the world. You can see that the confirmed cases globally today in the left graph, you will see that today it's almost in the peak, but maybe not at the ending of the epidemic. And even we cannot see the trend for the decrease of the epidemic. If we see the first top 10 countries with the highest daily increase, we will see that most of the countries today stay in the South Asia and the continent of America. So we will see how to stop the epidemics and what is the end of this epidemic. Firstly, I will share the information about that, our own experience in Shanghai. We know that the Shanghai today we have almost 30 million people in this city. So firstly, we have lots of imported cases from the epicenter of China from Wuhan. So here you will see that there's two waves of the epidemics. The first wave, we stopped the imported cases very quickly within 1 month, but today we stay in the second wave. However, the second wave today, all the imported cases stay in the closed circle. Now, no cases will go to the community. So therefore, there's no local transmission of the second wave. Therefore, today in China, almost 100% of our people, we go back to the normal life because all the imported cases today now stay in the closed circle and no cases will lead to the second round of the transmission. But if we cannot stop the imported case, what will happen? We can see we will see that there will be a lot of local transmission and there will be an outbreak. However, today we will talk about how to end the pandemic. First of all, we will think about what happened in 2003. There's a SARS happened emerged in China also. However, lastly, in the whole world, all the SARS cases, the number is less than 10,000. So today, our first question is about how to end the emerging infectious disease outbreak in the world. We will think about the difference between SARS and the COVID-19 today. I think the only difference between SARS and the COVID-19 is that for SARS, there's no asymptomatic patients. Almost every patient will have the fever, cough, and pneumonia. So we can find the cases very easily without detection of the disease. Therefore, today, when we think about how to stop the COVID-19, we will say that if we in 2003, if the SARS is the similar to the COVID-19 today, I think the situation will be totally different. So today, the COVID-19, I think, so lots of asymptomatic is the main cause that we cannot stop the transmission today in the world. So if we compare, there's a lot of other international emergency. So we know that WHO, they announced the public health emergency of international concern after 2003, there's 6 times, including this time of the COVID-19. So there's a 2009, there's H1N1, and 2014, there's outbreak of polio virus, and 2014, the Ebola outbreak in West Africa, and the 2015 outbreak of Zika in South America, and later there's an Ebola outbreak in Congo, and today we know that the outbreak of SARS-CoV-2, the COVID-19 today. We know that almost every the public health emergency of international concern issue will not stop today, and all the infectious disease today still stay in the world. So we can say that the COVID-19 will not go away by itself if we do not take any strategies to stop the transmission. So meanwhile, we will compare with another outbreak in China. There's H7N9 in 2013. The outbreak in China, however, we stopped the infectious disease quickly because we found that the natural host, the reservoir of the virus is stay in the chicken, in the poultry. So when we close the poultry market, we stop the transmission of the disease. So it's very important for us to stop the transmission, find the origin of the disease, and meanwhile, we have quarantine all the cases that take the virus. So our strategy today, the COVID-19, there's a lot of circulation of the cases in the world. What kind of strategy we can take? So according to Chinese experience, we take different strategies for different regions. For Wuhan, we know that this is an epidemic center of the disease in China. There's a lot of outbreak. So firstly, we stop the transmission. We should lock down the city and stop the transmission from Wuhan to other city. Then in Wuhan city, we shut down the city and stop the transmission from the community to community, from family to family. And meanwhile, for Shanghai, what is the city I stay today with 30 million people here, we just slow down the city. We do not do anything to shut down or lock down. We just do the testing, expansion the testing, we do the tracing, we do social distancing, and we let every patient hospitalized. So if we do not stop the transmission, we will see that the local transmission, the community transmission of the disease will be very expensively. So this is one city of the Europe. We can find that the second wave, so after the imported cases, is very large. So it's very important for us is to stop the transmission of the disease and stop the outbreak of the disease in a city without a case. If we compare the Shanghai, the city with 30 million people with no cases firstly, and compare that with Wuhan, we can find that these two cities in Shanghai, lastly, we just have 374 local cases. And today we have almost half a year, we have no local cases anymore. But Wuhan city, at the very early stage, we found that the city have 50,000 local cases. So I compare the cases of the COVID-19 within the two cities. I just want to say that the medical resource is very important for us to consider about what kind of the strategy we will take for fighting the COVID-19. If we see the medical resource in Wuhan, at the first stage of the outbreak, we will find that within the city, they only have 2,000 beds to quarantine the patients. However, we know that there are almost 50,000 patients there. If we cannot provide the enough beds for quarantine people, we will see that there will be a big outbreak and the mortality will be very high. So at a very early stage of Wuhan, the mortality rate of the disease is almost 7%. So therefore, later we shut down the city and lock down the city. And meanwhile, we set up the Fangchang Shelter Hospital to provide enough beds for quarantine patients. So at the mid-March, almost 40,000 beds we can provide for quarantine the patients. So we two kinds of the strategies we take today in Wuhan and Shanghai just because the medical resource is very important. If medical resource is overwhelmed, the mortality will be very high. Today, we know that the mortality of the disease among the other cities out of Wuhan is almost less than 10% and almost near the 0.7 today. So Shanghai, we know that yes, our city with lots of people here, we do not lock down the city, we do not do shut down the city. However, meanwhile, we do maximizing testing for all the suspected cases and their house contacts. And meanwhile, we do maximizing tracing for every confirmed cases. And once we find the patients with COVID-19, we will hospitalize the people in our designated hospital, and we can providing the maximizing hospitalizations. Our strategies is let the people not stay at home, but stay at the designated sites for quarantine. Because in China, you know that one family always have several people in a narrow space. So therefore, maybe there's a lot of family transmission if we do not quarantine the patients in the designated local sites. So our strategy is to maximizing testing, maximizing tracing, maximizing hospitalizations. However, the city keep the normal life in our city, even at the very beginning of the epidemics of the COVID-19. Some people will think about how about we do not stop the economics, we do not stop the normal life in our city. We can take the herd immunity. However, according to our experience in Wuhan, we can find that even today, if we do the serological survey for the whole city, we found that the positive rate of antibody to COVID-19 is less than 3%. Even in the healthcare work in Wuhan, is almost less than 4%. In other cities, just like in Guangzhou and the other city, not so many patients there, all the people resident there, the positive rate is less than 2%. So therefore, if we do the herd immunity, we will find that there will be lots of people there, and the overwhelming of the patients in the city will lead to the high mortality of the city. I think it will be a disaster in a country with limited medical resource and with lots of people. So if we compare the mortality of the disease within the United States and the Mexico, this is two countries very near. We can find that the Mexico, in this graph is the blue for the mortality. We can find that almost the people died of the COVID-19 is younger than 65. We can see that in Mexico, almost 65 of the dead people is very young. However, in the United States, we can find that almost 75% of the dead people is older than 65. So therefore, if there's a overwhelming of medical resource, we will find that the mortality will be very high and even in the young generation. So I think that if we in a country with limited medical resource, if we take the herd immunity, it will be really a disaster. So today in Mexico, we found that the mortality of the disease today is almost 10%, and in United States now today is less than 3%. So I think the strategy is very clear. We should stop the transmission of the disease within a country with a lot of people. So today, every country will take the adapted strategy to decrease the mortality. According to the data from the United States, the CDC, we can find that the first wave in the United States, we can find that lots of people died because at a very early stage. But today, even the higher elderly people, we can find that the mortality always decrease. So therefore, I think the adapted strategy is very important for us today to take the social distancing, mask covers, and other strategy to stop the decreasing, to stop the transmission of the disease, and find more strategy to end the pandemic. Today, so this is epidemics data from the United States. We found that the epidemics was not at the end of the disease and not even at the beginning of the end. So the India, we found that it's still in the peak. And in Europe, here's the data from Spain and almost very similar from the France. We can find that today it's the second wave of the disease. And so the current treatment options, this is a very important question for us. If we cannot stop the transmission, if we can find the therapeutics, if we can find a good way to treat the patients, even we have the disease, we will not die, and we can cure the disease by our therapeutic strategies. If it still work or not, I will show some data. So today there are lots of vaccine and novel agents now today were in the research and maybe in the clinical trial. But how about the results of the very early announcement of the pharmaceuticals for the efficacy of the novel agents? We can find that there's a lot of antiviral study today for developing the new drugs to fight the disease. It's really a race of the speed and the quality. And what about the outcome today? We can find that the remdesivir, of course, in the United States, we found that it can decrease the mortality, and meanwhile, it can make the recovery quicker. However, in China, we do the similar study. We found that the drug cannot decrease the mortality very significantly, and even it cannot inhibit the virus replication. And meanwhile, other drugs, just like hydroxychloroquine, ineffective. And WHO, meanwhile, announced that. And how about the COVID-19 plasma therapy? We know that the plasma therapy is the biggest limitation is that we cannot find so many COVID plasma therapy. Now, how about the neutralizing antibody? Actually, in China, myself also lead the study in here. But today we found that there's an announcement of the neutral antibody, the clinical trial result. We found that only the very high dosage that can get the efficacy for the disease to decrease the virus replication. However, other two dosage cannot get any results. So it failed to beat placebo in terms of reducing viral load by day 11. So therefore, I can say that even the neutralizing antibody today, it's not a good choice. So meanwhile, of course, there's a corticosteroids. In China, we have the very early strategy. I published a paper in the world at the very early at the March. I think that it really work that the corticosteroid. However, it only works in the very narrow therapeutic window. It can stop the progression of the disease. It cannot eradicate the virus itself. It just helps the host to stay longer and not die of the very high inflammatory response. So today, I will say that we can eradicate the virus. Of course, no, in the world. we should live with the virus. Of course, we have to live with the virus. In China, our strategy is just today keep the 0 cases in our country, but once there's an imported case, there is a local transmission in our community, just like in Beijing, in Yunnan and the other city in China. Today we have several cases of imported cases which led the local transmission. Our strategy is to find the case very early stage, stop the transmission very quickly, and do the expensive detection. So strategy is very similar for what we take today in Shanghai. So this is Xinjiang and Dalian. We can find that every time there is imported case and there is a local transmission, we will stop the outbreak very early and within 1 month. So today in the world, of course, there's a pandemic still is in the world. How to control the epidemics within the healthcare capacity is very important. Our strategy today is to inhibit the transmission of the disease, take the social distancing, and the other strategy is just to keep our healthcare capacity that will not lead to the overwhelming and decrease the mortality. So the international strategy for COVID-19 today is just to take a set alarming value. If there's a very overwhelming of the ICU beds and the medical resource overwhelming, we will take more stringent to take the social distancing and take some every strategy we can take to decrease the rebounding. So today the European to take some similar international strategy to decrease the mortality. So now, lastly, I will just several words about the strategy for COVID-19, the vaccine. The vaccine, of course, according to the Iceland model, we found that the neutral body, the antibody for the disease can take a very long time, and even after 4 months and the 6 months of the disease, and after they take the vaccine in China, we have some clinical trial. We found that the neutral body of the antibody can stay in the host for a long time, longer than 6 months. So I think still today there's a lot of hope for us to take the vaccine to fight the disease. So Ireland's model today, we found that they do quarantine, some similar strategy like that in China. So today in Iceland, the cases almost near 0. So today I think if you will take the very severe strategy to quarantine the imported case, I think we can, of course, we can do well. However, now today, lots of country, we have a lot of patients there. We have to take the adaptive strategy. And the hope, of course, is from the vaccine. Once the vaccine can cover some rate of the whole people, just like 30 people or 40 people, 40% of the whole population take the vaccine, I think we can decrease the mortality to less than 0.5%, just like the COVID-19 is very similar to the flu, the seasonal flu today. I think if once we have a vaccine, we can decrease the mortality of the disease, then I think we can reopen the city, we can reopen the world. So today, I think the global collaborations, the vaccines, and is very, very important. Once mortality dropped to a low level, I think the globally we can go back to the normal life. We can reopen the communication within countries. Thank you for all. For the strategy today in the China and in the world, I think we have to run faster than the virus and live with the COVID-19. And I hope that we can go back to a normal life very early and have the communication with all the people from the whole world. Is my really, I think, is my hope to end the pandemic very early. And I hope the collaboration in the world. Yeah. Thank you very much.
Thank you, Dr. Zhang, for painting a comprehensive and global picture of how to fight against the virus, different strategies, and also options of treatment. I'm seeing some questions coming in from the audience. So it's a Q&A time. I'd like to start with the first question from the audience. So the first question is, will COVID-19 situation be gone within 1 year, which means whether COVID-19 virus will be gone and the life will be back to normal within 1 year?
Okay, it's a good question. I think if we do not have effective vaccine, the COVID-19 epidemics will not end within 1 year. Because today we can see that even in the world, the pandemic, the trend is still in the very high level. In some region in the world is still in the peak. But even in the United States, we find that today there's some small rebound of the second wave. And in the Europe, now today there are lots of rebound in some countries, just like France and Spain. So therefore, if we do not have any strategy to stop the transmission, we do not have the effective vaccine, I can say that the ending of the pandemic cannot be happen within 1 year. But how about the vaccine? The first outcome of the clinical trial, the phase 3 trial, will be coming soon at the end of this year. Maybe at the end of the October or even at the early of November, the results from China, from Europe, from the United States will be coming. And if it works, I think we'll still stay for the distribution of the vaccine, and more people, I think at least 30% of the whole population or all the vulnerable people can take the vaccine, then we can decrease the mortality. I think we still need more time, just at least 1 year, to distribute the vaccine. Then we can decrease the mortality. But if the vaccine cannot be work, I think the time will be longer, maybe 2 years or 3 years. So today, I think we will wait for the efficacy of the vaccine in the world. It's very important at the end of this year. The vaccine works, it will be better. If not, I think we can still have to wait for the new hope for that. Thank you.
Okay, thank you. Thank you. So I see another question related to vaccine. The question is how to measure vaccines' safety and effectiveness.
Okay, now for the efficacy and safety for the vaccine, I think it's very important for us to wait for the results from the phase 3 study. So the phase 3 study will tell us some data for the safety. We know that in some phase 3 study, like the mRNA clinical trial in the world, we found that there's some adverse events, and they stopped the phase 3 study a very short duration. So we wait for the last results of the phase 3. But however, we have another data for the safety from the emergency vaccination. So in China, we almost take the emergency vaccination for the lots of people, but we will take some data from the real world, we will find that. However, the safety, I think the data not only from phase 3, but also we will get the data from the real world vaccination after the launch of the vaccine. I think in the world, about the safety of the vaccine, we will have some strategy to monitor the safety. So therefore, I think today it's very important for us to get the results of phase 3. Meanwhile, the effectiveness, the efficacy of the vaccine, I think today even we can take some very early results from phase 3 or phase 2 clinical trial. We can find that the neutralizing antibody level, it is very steadily keeping at a very high level. However, if we will find the efficacy of the vaccine, we need to wait for the protective rate of the vaccine. I think at the end of the October or the very early the time of the November, we can find that the protective rate of the some vaccine now today in the clinical trial. So the protective rates of the vaccine is the only golden standard for us to evaluate the efficacy of the vaccine. Thank you.
Thank you. And we have time just for the last question. One audience asked about the traditional Chinese medicine being prescribed to many COVID patients. Any studies on the effectiveness of those TCM? Does the TCM boost the immune system of patient or an individual?
Yes. In China, we have done a lot of clinical trial to evaluate the efficacy of TCM. We know that in China, this country, we have a long history, and the TCM also we have a long history. We know that in other countries, every country have their own traditional medicine, just like in Mongolia and in the country in the South America, and we can find that there's a lot of therapeutics with their own traditional treatment. We can say that it's a complementary treatment in the Western medicine. But today in China, in our patients, we almost take the one side we take the Western medicine to treat the patient. The other side we will take the TCM together. So I think today in China the mortality rate, of course, it's very low. Today in the city other than Wuhan, in Shanghai today, we almost treat 1,000 people here. Today the mortality rate at a very low level, and now in imported case in Shanghai, recently I treated almost 600 patients and no patient died. Of course, I think all the results of our treatment today in China, it's not only one strategy. I think we combined the TCM, the Western medicine, and every strategy we can take to treat the patients. The most important today, I will say that how to avoid the overwhelming of the medical resource is the most important. Of course, the combination of the Western medicine and the complemented the TCM and the other strategy also it can work. Today we just say that we will see the results, we will see the outcomes of all the treatment. But of course, the core of the treatment is that how to stop the overwhelming of the disease is the most important. If we can stop the overwhelming of the disease, just like today in the United States, we can find that the mortality is decreasing very fastly, and of course the treatment meanwhile can help to decrease the mortality of the disease, including the TCM. Thank you.
Thank you. Thank you so much, Dr. Zhang, for your presentation and the Q&A.